Good afternoon, everyone. I'm Michael Flora with MTM Services. My pleasure to be back with you. Welcome back as we look at part 3 of our 3-part series on collaborative documentation in a telehealth environment, the wrap-up. So thinking about how we transition with collaborative documentation, we usually use that wrap-up session. Remember, we're going to document a little bit at the beginning of our work together. We're going to minimize the screen just so we can see the two screens, your client and yourself perhaps. And then we're going to go to our wrap-up session. We're going to synthesize about a quarter till as we're sort of wrapping up that service encounter. So think about how we want to do that. How do we actually do it with that collaborative documentation? Remember that after you've provided your intervention with your consumer or family, we'll want to use that traditional wrap-up time at the end of session to document the work that you've done. And this is something that we as clinicians have traditionally done over time, is that we use that to synthesize what we've done, to sort of bring closure to that session. We might even say something like, we're getting close to the end of our session, so let's stop here and document the important work or the things that we've talked about. Like our previous webinars, I'm going to invite Joy Fruth from our MTM family to join us today and kind of work with us as we kind of role play the wrap-up session. Welcome back, Joy. Thank you're here.
Thank you. Hi.
Hi. Remember, team, we're going to work with the intervention. We've already done that part, which is here. And then when we're going to get close to the end of our session, we're getting close to the end of our session, so let's stop here and document the important work that we've done. We might use something like this. So now let's work together to document the important accomplishments, ideas, or work that we've done today. We're getting close to the end of our session, so let's stop here and document what we talked about. What you shared, Joy, was very important. Let's capture that information. So we're going to focus in on the response and progress towards goals and the plan for next week as part of our intervention with Joy today. So with this, Joy, when we talk about kind of our interventions, let's talk about some of the things that we did today. So we're getting close to the end of our session. Let's stop here and document what we talked about. What were some of the things that we did in treatment today, Joy, that you found helpful?
I found it helpful to do the role plays that we did so I could practice, using some of these techniques like checking the facts and using my diary card as a prompt. That was helpful. So that's what I would say.
Okay. So what we're going to do here, team, is we're going to actually then go to the progress notes. We're going to pull the progress note up on our computer, and I'm going to document. So therapy used examples provided by Joy of recent family confrontations to review strategies for avoiding angry outbursts. We role played some examples that Joy could practice. We also worked to identify whether some things that she could do, like checking the facts, reviewing her diary card for positive prompts, that might make things easier for her at home. Now we're going to move to the client's response to treatment. So based on those interventions, Joy, how did you feel you responded to those? What did you like most about those interventions? What was helpful?
Well, as I said, the role plays were helpful, but I think what I struggle with is remembering to do some of these things when I'm at home, when I'm in the actual environment. So, but practicing in session helps to reinforce all of that so that when I'm faced with, being triggered by my mother, hopefully I'll remember. I want to do better. Three times this week, three fights this week. I want to get down to 1.
Okay. So very good. So what we're going to do then is go to our response. So Joy worked well in session and agreed that techniques made sense, but she still has problems thinking of doing them at home, indicated she would try. So now we're going to move to and transition to our plan. So as we work with our interventions today, Joy, what do you think our plan for next week would be? What are the things that you would like to accomplish? I know you said you'd like to move it down from 3 angry outbursts with your mom to 1 or less.
Yeah.
What's your plan? How do we want to accomplish that?
Well, I'm going to practice. Checking the facts is a difficult one for me, but I'm gonna practice that. And I just need to work at it. I just need to practice and really having that goal in mind of no more than 1. I think it will be helpful. I'm just kind of saying that to myself over and over in my head. No more than 1.
And using that diary card, going back and looking to see what worked, right. What would you like to change, what would you like to do differently when you're caught in the middle. How would you rate your progress, Joy, between the work that you've done so far? How do you think you're doing on our goal number 1 of reducing angry outbursts?
Since we had 3 arguments, I think it could be better,
Mm-hmm.
but I am working at it. So I think, I don't know. I think good, not great, maybe good.
Okay, so good. So we're going to document good for Joy. We're going to say that Joy's learning techniques, but still needs to use them more in order to achieve her goal related to reducing family arguments. She reports at least 3 arguments this week. And then we're going to move to kind of the plan. So remember, the plan is the last thing I work with her on today and the first thing I review next week. So any skills or techniques that we agreed on, anything that you as the clinician agreed to do as part of that. So what we're going to do is, so Joy, as she had already told us, is that she's going to practice at least one technique practice today and work on checking the facts, reviewing her diary card for positive prompts before engaging in an agreement or argument with her mom. And Joy also reported that we have an appointment with this clinician next week and also with her psychiatrist next week. And so think about, the things that worked for you. So Joy, from a consumer's perspective, how was it? How did it feel kind of seeing the note and interacting in a way as part of our work together, sort of through telehealth as opposed to in the office?
Well, telehealth is really helpful. It's better than just being on the telephone. So that part is really helpful. I think seeing the note, I really like that what I said, you wrote as if it was important. And also having it written down, I think makes me feel more accountable to the things that I said I would do. So I think it's very helpful. And it's also helpful to leave this session with that plan at the top of my mind. What are the things I need to be working on as we wrap up?
And think about the plan as sort of our homegoing instructions. Like when you go to the primary care physician, your PCP might give you, these are the things I want you to follow up on. The plan is really the things that we want Joy to follow up on or a consumer to follow up on between now and the next time we see her. And so by being able to be present in session, and that I think what's happened is part of our telehealth work, what I'm finding nationally in a lot of this with clients coming to me and saying, this is, we had to move to a teleplatform, but my clinicians feel this is more engaging. They're finding it very helpful and easier to document collaboratively in a tele environment. And I think what the part of that is that the elephant in the room being the computer, the screen, now actually becomes part of the intervention. So just as the note is part of the intervention, we're finding that the computer itself, the screen, is now part of the intervention. It's another tool in your toolkit as a clinician that you're able to use. And the other thing that's nice is I could bring up, some fact sheets that maybe Joy wants to use, and I could print those off or send them to her via email of things that she might want to do. So there's an opportunity to be able to use technology as part of our therapy platform and intervention. Joy, how about you?
I agree. I think what now keeps us connected is the computer. So where it might have seemed awkward to include it when you're in your office, even though that takes practice to get to that level of comfort and you can achieve it, I think now it is the thing that's keeping us connected. So very, very helpful and actually supportive of the collaborative documentation part of the interview.
Thank you, Joy. Appreciate your time, everybody. Thank you. Joy, any final last words?
Nope. Thanks, everybody.
Thank you, everybody.
Stay safe.
Stay safe, and we look forward to talking with you soon.